You're listening to The Scoop on Ultrasound, where the world of ultrasound imaging comes alive through dynamic conversations. This episode is brought to you by EDM Medical Solutions.
In this episode, we're joined by Lashell Jones, a highly experienced fetal medicine sonographer with over 20 years in women's health. As an advanced perinatal sonographer at Maternal-Fetal Associates of the Mid-Atlantic, Lashell specializes in fetal echocardiography, maternal-fetal medicine scans, and patient safety procedures. She's also a dedicated ultrasound educator, creating CME content for the Institute for Advanced Medical Education and authoring the Fetal Echo Question Bank. In 2024, she launched Ultra Pro-Cert, a platform combining ultrasound education, professional networking, and consulting. Lashell is here to share her expertise on advancing ultrasound education and fetal imaging. Quality supplies make a difference. At EDM, our mission is to help you enhance patient care. For over 30 years, we have been a leading supplier of medical imaging products and accessories. It all started with one product, Crystal Ultrasound Gel. And now our catalog includes over 300 products designed to support your practice. From probe covers to needle guides, EDM Medical Solutions is the partner of choice for over 2,000 healthcare facilities in the U.S. Learn about our range of ultrasound solutions on our website by visiting us.edm-imaging.com.
Welcome to the Scoop on Ultrasound, where we explore critical topics in ultrasound imaging. Today, we're focusing on patient safety and care in high-risk pregnancies, a field where innovation and compassion are so important for both mothers and their babies. And we're honored to welcome Lashell Jones to the podcast. Lashell is a highly experienced fetal medicine sonographer at Maternal-Fetal Associates of the Mid-Atlantic. She has over 20 years of experience in women's health. She's an advanced perinatal sonographer and holds the RDMS credential and the certification in first trimester screening from the Fetal Medicine Foundation. Lashell's expertise spans fetal echocardiography, maternal-fetal medicine scans, and patient safety procedures, where her compassionate and professional approach has been a source of comfort and confidence for expectant families and referring physicians alike. Beyond her clinical work, Lashell is a passionate advocate for ultrasound education. She contributes as a course creator and educator at the Institute for Advanced Medical Education, crafting high-quality CME content. She's also the author of the Fetal Echo Question Bank, which is a learning tool designed to enhance diagnostic skills with over 150 questions and detailed explanations. In 2024, she launched Ultra Pro-Cert, which is a platform that combines ultrasound content, professional connections, and consulting services. Guided by her mantra, each one, teach one, she's on a mission to make learning both fun and impactful. Lashell, we're truly thrilled to have you on the show to share your insights and your vast experience with us. Thank you so much for being here.
Thank you. And I am honored to be here. So I appreciate the invitation. I'm excited. So
Yes. So let's jump right in.
Sure.
I came across a study not too long ago showing that over 15% of pregnancies in the US are classified as high risk, and they often require advanced imaging and a multidisciplinary approach for both mom and baby and for their health. And so I'd really love to hear, and I think our guests would too, of how your journey has shaped your perspective on these challenges. Can you tell us about your background and your experience in MFM, particularly in managing those high-risk pregnancies?
absolutely. I was one that was really lucky enough to done MFM for my entire career. Back 20 years ago, it was unheard of for a MFM office to even offer the opportunity to a new grad. And so I was lucky enough to be trained by one of the best perinatologist, and she taught me everything that I know for this day forward. And so MFM is all I know. I know some like to either they cross train from OB to MFM, but I've done MFM sonography for the entire 20 years. And I must say, I love it. I really accept the challenge of MFM because it is challenging, not only dealing with the high risk topics or pregnancy complications that you're seeing, but you're dealing with the patient's anxiety as well. And so I just love the field and everything that it has to offer with it too. So
Right.
I
It's
enjoy it.
tough, but it's
It is tough. It
yeah.
it it is. It is.
Yes, it is.
Mhm.
It is. And fetal cardiac health is one of the most critical areas for evaluation. So you're in a position where you're in a very important position, right? For
Absolutely.
fetal health. And I just wanted to say how a recent review in the journal Maternal-Fetal Medicine highlighted that diagnostic precision is advancing, but the study raised concerns about the safety protocols during imaging. And so, how do you balance those priorities in your practice? How do you approach the use of echo in those high risk pregnancies, especially from your perspective as someone who's been in it the whole time, as you say, all those 20 years? How do you approach that?
First and foremost, we all sonographers had to first do ultrasound physics. And so it goes back to what we've learned in our ultrasound physics courses, and that's ALARA. Every sonographer knows the acronym ALARA, and that's as low as reasonably achievable. And so when you go with that approach into especially looking at the heart, you think about turning on color in the first trimester, the benefit outweighs the risk because briefly you're just looking at those heart structures with color to potentially diagnose congenital heart defects pretty early on. And so, in that case, with that mindset, it's you're balancing the precision of diagnostic purposes as well as safety for the baby as well as mom as well too. So it's really important to remember those fundamental principles that we learned with the physics. That's something we learned prior to achieving your OB certification. And so you just have to remember your ultrasound physics principles when you've done
Exactly.
with safety.
It goes back to the basics.
Back to the basics. That's one of my other mottos too. Back to the
Back
basics.
to the that's really great. I imagine factors like fetal positioning, maternal conditions such as obesity or scarring, they can make it tough to get accurate measurements. And
Mhm.
sonographers have to push past those things, MFM sonographers, to be able to achieve the results they need, right? So, could you share with the audience any strategies or technologies that you yourself over the years have found particularly helpful that have really attributed to success in those situations where you're really encountering more roadblocks than you would have originally expected?
Absolutely. And once again, going back to what we learned in physics, when you're dealing with obesity, change your probe. Use a lower frequency. A lot of times with high BMI, I will switch the transducer to a C3 through 5. Occasionally, I would use my 3D probe as well
Mm.
to get that higher frequency. And another technical challenge that I have seen is in cases of retroverted uterus or retroflex uterus, especially in the first trimester. Dealing with the uterine position, it's helpful to use the transvaginal probe because then in those cases you're bringing the uterus closer to you when you're using your transvaginal approach, as well as achieving the higher frequency as well. Those are some techniques that I use. Let me think. Color is key as well, and so with your grayscale, if you have a high BMI patient, it may be harder to achieve a four-chamber view. But if you add in color Doppler, it's easier to see chambers and even pulmonary veins depending on the setting that you're using. And so just remembering your basics and then color is key. And then the transvaginal approach. It's very helpful in those settings.
Right. So
Mhm.
you have to be creative. That's
Oh,
the
oh,
solid area. You gotta be creative about experimenting, gotta keep trying.
yes.
Yeah, yeah. It's really like being an investigator, so to speak, in it. Right. It's so important in sonography, right? That's the clinical experience. Now, you mentioned something, you mentioned 3D, and we're gonna touch on that now because it's really fascinating, isn't it? How
It is.
3D, 4D imaging is revolutionizing diagnostics. Studies suggest that integrating AI as well, which has been a big topic, especially in recent, integrating AI for real-time analysis can reduce errors significantly. In some studies, it's shown already that it is reducing them. So, what are your thoughts on these innovations, especially again, as someone who you've seen the field changing, right? You've been here for 20 years, you've witnessed a lot. What are your thoughts on it? Do you think it's something that should be embraced? Where do you stand?
Absolutely. Oh, we most definitely should embrace these new technologies,
Mm.
especially 3D. I feel like it's a complement to what we're already achieving with that grayscale imaging. 3D has been able to confirm diagnosis that we suspect that there's an issue, but 3D just put it more into perspective. I have a few examples. Uh, Think about your umbilical cord and you're trying to see if there is a true umbilical cord knot. 3D really helps put that in perspective.
Mm.
Another thing that recently just happened, actually, we were able to diagnose placenta invasion. And so we were able to suspect that there was a creta forming. She was only about 8 weeks pregnant,
Mm.
but we suspected, we did a 3D, and we were like, "Okay, yeah, this really looks like a cretiformin."
Wow.
And a MRI we ordered, and it was indeed placenta invasion. And so that was a helpful diagnosis for that patient early on. And so definitely embrace those 3D technologies. Now, as for AI, I love AI. I mean, it's a game changer, and honestly, AI has made my job easy, just like with my annotations, with my labeling, with my measurements. It's time effective. And if you think about it, some days we have more patients than we have time. And
Yes.
so the AI tool is really helping really deviate these time slots that we have. We have to complete our scans within 30 to sometimes 40 minutes. And so with these AI features, it's really helpful in those settings. And so I would say definitely embrace those technologies.
A lot of times, sonographers are already overwhelmed. It's no secret that we have a shortage. You know, we especially have a shortage, I would say, in MFM, right? We have a
Yeah.
specialized sonographers who can take on these cases. So I think sometimes you hear the fear of, well, new technology is going to overtake us or it's going to replace us. But I think that it's a misplaced fear because it's what you're saying. It could be a time saving measure. There's simply things that really are taking your time as a clinician that you don't really have to do, but you have to do it because no one else is going to do it. But if the AI can step in there, it really allows you to be able to focus on the more important aspects of the job. Absolutely. Scanning, doing the investigation, right? Okay, taking that case, taking the time to do that, and also to be more efficient. And efficiency is key, especially when you have sonographers who are feeling overwhelmed and you have more and more clinicians who feel like they're burnt out faster, which is sad. Obviously, you're a good example being in the field for a long time, because you've been here for 20 years and you're not burnt out. And I would like to ask a follow up on that. Of what tips would you give for clinicians, especially new ones, that are feeling sort of overwhelmed with the demands of the job? What tip would you give? You know, if they don't have the AI, let's say, in place yet, that can help them. What tips have you found over the course of your career to be able to handle such a caseload?
Um, One particular tip I would say, and it's something that I follow, is just remember, especially when you're dealing with a fetus, it's unpredictable. So I always say the fetus or the baby, it kind of dictate what pictures I'm going to start with. And so a lot of times when, for instance, for sonographers, when we put the probe down, we put the probe down, and right away we see the fetus is face down, spine up,
Mm.
and looking away from us. And then right away, and I've heard sonographers say, oh, I won't be able to get anything. But
Mm.
how I look at it is, oh, baby's in a perfect position to image the spine. That's the ideal position for my spine views. And from there, I can go to my sagittal heart views. And from there, I can see abdomen, I can see diaphragm, I can see the post fossa of the brain. And so as I'm going and navigating through the fetus, then eventually, guess what? They turn over. And so I'm able to get the heart views. I'm able to get the face views. So just having that positive outlook from the start, it will just kind of set the tone for the exam. I just feel like the fetus pick up on your energy.
Yeah,
And so they know to give you a hard time. And so I just always try to have a positive outlook and just, when I'm scanning. And so it really helps make the job easier.
that's such valuable advice and so true, right? Because the mindset is going to influence performance. And, especially if you're already tired and you're like, oh gosh, like now we're starting off like this, it can really change things. It can change things. And yeah, maybe baby can sense it. Maybe he or she can sense it and is like, you know what? I'm not going to turn over for you. If you are high-level disinfecting your ultrasound transducer, it's likely you're soaking the probe or using an automated HLD device. But there's a better option out there. TriStel Old can high-level disinfect your transducer in just 2 minutes and costs under $3 per cycle. Sound too good to be true? Request a brochure today and learn why so many practices are switching over to TriStel Old. Visit us.edm-imaging.com/TriStel. That's TRISTEL. And now, back to the show. So now going back into the topic of high risk pregnancies as a whole, right? As
Mhm.
a journey that isn't just a medical one, but also an emotional one for patients, for their families. It's difficult, of course, for the mother, also difficult for the family that's involved. And then sometimes you have mothers that really don't have that family support. So it's really just a difficult situation all around. And it really is an emotional one, not just a medical one. So I'd love to hear how you build trust and you provide reassurance, especially when dealing with complex diagnoses that really the patient doesn't even truly understand, and they're asking themselves, why is this happening to me? How do you step in as a clinician to not just give that patient care, but to also give that support?
First and foremost, it's all about comfort. And so if a patient doesn't feel comfortable with you per se, they tend to have a mistrust, I guess you can say. And so just making them feel comfortable and your tone, they pick up on those cues. And I've been told that I have a very common tone. And so for some reason that allows them to be calm as well. Even still, whatever they're facing, just my bedside manner, it really
Right.
helps.
Mm.
And so I just try to look at it like, how would I want to be treated in this same setting? Now, far as the difficult or the complex topics that they are facing, I try to, if they ask a question, give it in a more simplified manner so then they understand. A lot of our patients, we have a lot of diabetic patients, and so they're having constant or weekly, some twice a week biophysical profiles. And so the question that I'm asked all day is, what's a BPP? What's the point? What's the point of this? Why do I have to have it done? And I've noticed ever since I say we're going to do vitals, or BPP is like a vitals per se of the fetus, then they understand the importance of vitals. And so they're understand, "Oh, okay, so I see why you need to do this or why I need to do this." And so just breaking things down in a more simplified way really helps just, for them to understand the whole meaning of these complex issues that they're dealing with.
That makes sense. And I think that it's so easy as a clinician because one is the expert on the topic
Right.
to just be explaining things in a way where you understand and your colleagues understand it, but maybe the patient is like, what does that even mean? And it's easy to be so overwhelmed with the work you're doing to sort of forget, okay, I have to now explain this in terms that make sense to the person, right? Because to explain it in ways that don't make sense, I feel only adds to the anxiety of the situation.
Right.
And I think what you touched on is something that a lot of our other guests who've discussed patient care and patient comfort have touched on, which is basically the golden rule, right? How would I want to be treated if I was in their shoes? And that's something so important for clinicians to keep in mind.
Absolutely.
So, in addition to that, MFM as a practice, we talked about how it's multidisciplinary, right? So a collaborative approach really seems to be a common thread in achieving improved outcomes, quality outcomes. So, do you have any examples of how new technologies or research findings have transformed care in your experience? How do you keep up and how do you make sure that your practice is evolving with the times and that you're having that sort of collaboration that makes sense with the other clinicians?
Right. I recently just was promoted as director of education. And so with that position, that entails me to keep up with that. So we are on the front line. I mean, we're on the front line with these congenital defects and finding them first. And so you want to be informed, you want to be prepared in order to seek these defects. Now, one thing I forgot to mention earlier about fetal heart health is that it is the number one common birth defect in the world. Number one. And a third of these heart defects are diagnosed in utero. A third will be diagnosed once the babies are born.
Right.
But unfortunately, another third won't be diagnosed until the baby falls ill or usually maybe passed away, it's autopsy and so forth.
Right.
And so first and foremost, we all have the same agenda. We want to achieve diagnose these defects prenatally so we can maybe set things up differently. And so far as delivery outcomes, they're in a proper care setting where they're able to receive the help that they need before they become ill. And so it's all about quality assurance, collaborating with everyone, just want to be on the same page and not amongst just MFMAMA where I work, but you amongst everyone throughout the region. You all want to be in the same page far as taking the same amount of pictures, the same quality imaging in order to detect these birth defects prenatally. I did want to mention that I had recently put out a poll on ultrasound protocols. Okay. Now, if you're not familiar, it's just basically a list of images that we take amongst I guess you can say each ultrasound that's used throughout the MFM practice. And so with these protocols, it really just kind of set that agenda in place.
Mm.
And so once I set these protocols out, I received over 10 to 20 messages from other MFM practices that are not using protocols. And so they're just taking pictures. They're just taking, I guess, head pictures, your standard measurements. And so
Right.
that really let me see that, okay, there is a need for having a agenda in place. And at the end of the day, we all have the same agenda in mind. And so I said all that to say that. In other words.
No, that's really great. It's great to hear the fact that collaboration
Yes.
is being promoted, has to be promoted. And I think that our societies, right, that are involved in this, have to have play a pivotal role as well, right? I think that awareness is something that is so important. And I think that there's a lot of clinicians such as yourself out here promoting the awareness around MFM, its importance, its need, and hopefully, stoking that desire in other sonographers to join MFM. They'll get the credentialing and to learn how to do it. And maybe even for those who are starting, like you said, usually people don't start MFM, that we would have a new generation of sonographers that would be interested in starting there, hopefully, to address that need. And as we close, because you've already provided such great advice, I would love to know what one key piece of advice would be that you would give clinicians no matter what stage of their sonography career they're in, the one key thing that you would say, this is the most important piece of advice that I could give you for your career, what would that be?
Hmm, I have several. Let's see.
It's hard to narrow it down to one, so maybe you could give us two good
Sure,
pieces of
sure.
advice.
Starting out I have actually, so I have two. I have one for new techs, new grads starting out, and then I also have one for the season. So it's just starting first with new grads, new techs, especially if you're considering MFM. I will first say consider it because a lot of times, like you said, they don't want to consider doing MFM work. So please consider doing MFM work. We need help. We currently at where I'm at, we have a job opening and we cannot find MFM techs. And so we open up the job posting for new grads. And please, please don't be afraid. It's challenging, but I must say it is truly rewarding at the end of the day
Right.
to know that you've had a chance to help a family, to help a precious life. It's that what's more rewarding than that? And so I would for my new grads, I would say please consider MFM as a field. It's not that scary. Come on over. Come on over. We really need the help. And so that's for the new grads. For my season techs, I want to say we can never know too much. I'm always learning. I'm reading an article or I'm learning something new in the field almost every day. And we're never too is there's never a point where you can say, I know everything. I'm sorry. And
Right.
so just keep learning. I want to say for when you're when think about when you're scanning and you're before you start taking your pictures, I have a model that I follow and I say seek first. What are you seeking out? Or whether it's the baby's brain. Are you seeking for brain anatomy? Are you seeking the fetal heart? Are you seeking extremities? Are you seeking face? So seek first, then sweep. Sweep through that region of interest, and then you take your pictures. And I'm telling you that has been a game changer. That's something that I followed, and I never start taking pictures before I do a proper sweep through the fetus. And so that kind of just set a roadmap for me to know to get my destination at the end. And so first want to say that I'm happy that once again that you did invite me here since we are closing and that I appreciate the invitation, and I hope that someone had a takeaway point, from this interview, and so thank you again. I do wanna express that.
No, thank you. I'm sure they had a lot of takeaways. It was a really enlightening discussion. Thank you so much for what you do and for taking the time to come on and just share all of your experience.
Absolutely. Thank you.
Thank you for listening to this episode of The Scoop on Ultrasound. Subscribe today to be notified when new episodes are released, and visit our website, us.edm-imaging.com, to learn more about who we are and what we do.